Participants may choose to utilize supports in each of these categories or just a couple. The kind of supports utilized in each plan is going to look different for each participant based on what their own unique assessed needs are. Before getting into specifics, let's get into some of the rules that must be followed for expenses to be considered. It is true that CDCS option allows for more flexible use of the funds than traditional services, but there are rules to be aware of. Any expense must address an identified need in the MnChoice assessment. This ensures that all goods and services are related to the person's disability or medical diagnosis. The requested expenses must meet all waiver criteria. The waiver criteria were and continue to be established through federal and state statute and laws. Individual counties, including Carver, have created their own CDCS guidelines with the goal of providing more clarity and practical direction as it relates to these laws. Our guideline can be found on the CDCS webpage. Our guidelines are meant to help with considerations regarding different expense requests within the various category, and it offers additional insight into how decisions are made in approving or denying a particular good or service. The items and services in our guidelines should not be considered a menu of goods and services that are allowed to everyone on CDCS. There are many considerations we must look at when determining what can be approved for each CDCS participant. The questions asked in approving or denying an item is to first ensure that the request is associated with a need identified in the MnChoice assessment. When reviewing requests, we look at whether the request is cost-effective, what other MA services have been tried, or other funding sources that may be available. It is for the sole benefit of the participant, and the list goes on and on. So determining which expenses are allowed for a participant is not as simple as it may seem. You simply cannot say that since an iPad is listed in the guidelines, or my neighbor who is also on CDCS got an iPad, I am allowed one too. There's a lot of decision making that goes into each request. Because so many factors go into determining what expenses will be approved specific to your loved one. Your support planner or case manager may ask you these clarifying questions to assure your request meets criteria and can be clearly communicated to the lead agency for approval. Counties or lead agencies must prior approve everything when using these public dollars. We try to honor personal preference within the waiver requirements. Waiver funds should not be looked at as the first resort or at the end-all be-all. For example, if your primary or secondary insurance covers diapers or physical therapy, insurance should be used first. Waiver funds can be used when the need is greater than what insurance covers. CDCS can cover over and above costs. For example, MA puts a cap on the number of diapers it will cover for a participant over the age of 4. CDCS can pick up additional diaper costs after that limit has been reached. Or if your health insurance covers a certain number of physical therapy visits, CDCS could be used after those visits have been exhausted. Or if the participant needs a tablet for communication only, they must order this through medical assistance. However, if the tablet is needed to address needs beyond communication, then CDCS funds may be used. So even though it may be more convenient to make purchases through CDCS funds, other funding sources must be used first. Another reason we have to ask so many questions is that if we approve something that does not meet criteria, we as a lead agency are held financially responsible and could be asked to pay those funds back. Now let's look at the first category, personal assistance. The personal assistance category is primarily your staffing category. Unlicensed staff are hired to provide support for a participant in everyday skills and activities, behavior supports, and supervision. ADLs refer to assistance needed above and beyond what is typical in the area of feeding, dressing, grooming, mobility, transfers, and toileting. IADLs refer to the assistance needed above and beyond in things like shopping, meal planning, finances, communication, household management, and participating in the community. Young children may not always work on an IADL skill, but most people on CDCS tend to need help in several of these areas. Unlicensed staff are hired through your Financial Management Service, or FMS, to help your loved one either physically or verbally with these activities. Unlicensed support staff can be a neighbor, friend, or relative, or anyone else that is qualified to do the job and is able to pass a background study. There are also different types of roles unlicensed staff may perform specifically, such as environmental support staff, primary caregiver relief staff, or companionship. You, as the managing party, decide what the job description will be in these areas and what qualifications they must have. Qualifications can be things like personality qualifications, training in education, ability to learn, or strength in being able to handle transfers. Unlicensed staff can support the participant in both the home and in the community. You will be responsible for helping to get your staff hired through the FMS, trained, worked into a schedule, and directing their activities when they work. An unlicensed staff support may work in a specified number of days in a week for a certain amount of time. They could work with the person on such things as pedestrian safety skills while in the community, their name, address, phone number, or increasing the person's ability to independently use the bathroom. Other tasks could be helping the person manage their sensory and behavioral needs, ensuring the person makes healthy food choices, helping the person choose a safe water temperature when bathing, washing hands, or simply helping them clean up after eating, and so on. These skills or activities may be tracked as a specific goal, especially if funds are being used to support the development or maintenance of these skills or activities, or could be part of a job description or expectation of caregivers per the health and safety plan. Wages for the support person vary and are chosen by the participant and or managing party. Typically, wages fall within a minimum wage set by the Service Employees International Union and the current maximum state set PCA rate. The support staff's wage should make sense for their qualifications, training, length of employment, and or the person's assessed needs. Generally, you would not want to start a 16-year-old at the maximum PCA rate, as they likely will have little training or extra qualifications or longevity of employment. Managing parties are allowed in certain situations to make a case for a wage that is higher than the maximum PCA rate. Please see our guidelines to see what considerations are considered for this scenario. As mentioned earlier, unlicensed staff may look a little different depending on the job description. Most unlicensed staff work with the participant on ADLs, IADLs, behavior, and supervision. However, there are unlicensed staff that are hired to focus on other primary assessed needs. First, there is primary caregiver relief. The main goal of this person is to provide relief to the primary caregiver, which is often the parents, so that they can take time to themselves and ultimately the participant is able to continue to live in the family home. The primary caregiver relief staff may come for a few hours a week, or the primary care can go out to the movies with friends, have date night, or a grocery shop. They might come so the primary caregiver can get these things done around the house that they normally cannot get to because of supervisory needs of the individual. It could be that the support staff stays at the participant's home for the weekend or at the staff's home, so the primary caregiver can go away for the weekend. It is important to remember that primary caregiver relief staff are paid for the entire time that they are providing support. So let's say the primary caregiver relief is an aunt. The child spends the night at aunt's house twice a month. Child gets there at 5 p.m. Friday and is picked up at 5 p.m. on Saturday. The primary caregiver relief staff or aunt would be paid for 24 straight hours. Hours must be closely monitored in this situation, as hours could quickly reach 40 hours and go into overtime. These hours need to be strategically planned or overtime approved by the case manager in advance. Primary caregiver relief is sometimes called respite. Respites and primary caregiver staff is the same service except respite is the licensed version. This will be discussed more in the treatment and training section. Another type of service in this section is called environmental supports. This includes cleaning or chore services that is provided by the individual person hired directly by the FMS. This person may be hired to primarily perform deep cleaning tasks or outdoor chore services when the participant's level of care makes it challenging for primary caregivers and other household members to keep up. Providing a clean, sanitary, and safe home environment is a typical parental or household member responsibility. Able-bodied persons living in the home and staff, when they are working, are required to provide light housekeeping themselves, such as wiping off kitchen counters or the kitchen table after meals. If the participant lives independently and has physical disabilities that impede their ability to do light housekeeping, light and deep cleaning services may be considered. Independent contractors can be hired to provide this service as long as the FMS has verified that the individual qualifies as an independent contractor. Finally, another type of unlicensed service for staff is called companionship services. This type of service may already be part of the support staff's job description for someone over the age of 18, and it would strictly be used as companionship. This is a common service for elderly participants that may be isolated. A staff person can come by 2 times a week to play a game for an hour or have coffee and talk about local issues. Next, we will look at some of the other considerations in this area. The treatment and training category has a range of services that increase the person's ability to live in and take part in their community. These services are to improve, relearn, and/or maintain skills. Most of these supports require a license to provide them. Services that are commonly used are adapted community classes, alternative therapies or treatment, consumer or caregiver training, camps, employment supports, and/or licensed wayward services. Adapted community classes may be fundable when it addresses an assessed need from the MnChoice assessment. Because the person is certified disabled, waiver funds can pay for the participant's fee for the adapted activities, such as adapted sports or adapted swim classes. Typically, community classes are activities like a dance class or an art class. Registration or entrance fees are not usually allowed, as the class is not generally addressing an assessed ADL or IADL, and is typically requested for socialization, communication, or sensory, which can be done in settings and situations that do not require payment. However, if the person has an interest in a community class, pays the registration fee, but then needs extra support during the class, the support staff may be paid to attend with them. If the class requires an extra instructor or support person to help the participant, resulting in a higher cost for that class, then CDCS could pay the difference. Waiver funds could also be used to pay mileage reimbursement for staff driving the person if it is part of their shift. So for example, Leo wants to join a typical karate class. Leo or his parents would be responsible for paying the registration fee, but CDCS funds could pay support staff mileage reimbursement to take Leo to and from the class, and or pay staff to provide additional support while attending the class. It would be appropriate to pay staff wages to be there during the class, to provide emotional or behavioral support during it, or to help Leo stay on task. CDCS funds can only be used to pay for supports needed above and beyond what is typically needed based on their assessed needs and disability. We cannot use the funds to pay for the person's interests or hobbies. There may be times when a typical non-adapted class is funded through CDCS. Here's an example. Tiffany is 20 years old and is starting to plan out what skills she must learn to move out of her family home. One of her struggles is being able to safely cook and make her own meals. Over the years, Tiffany's parents have tried to teach her how to cook and learn basic kitchen safety. However, she struggles taking direction from them. Tiffany wants to attend a basic cooking class at the community center. This basic cooking class, though not adapted, could be paid through CDCS since it is addressing an IADL need. Tiffany has tried other ways to learn that have not worked. It is cost effective, and she is motivated to learn the skills so she can become more independent. Another option in this category is alternative therapy or treatments. These are non-experimental treatments that are not covered by medical assistance. The therapies or treatments must be delivered by licensed or certified specialists in that field. An alternative treatment form must be completed and approved by the Waiver Approval Committee. Some common alternative therapies are hippotherapy or horse therapy, music therapy, aquatic therapy, cognitive or education therapy, or behavioral therapy. An alternative treatment form is required by an MHCP provider in order to approve these therapies. We leave it up to the professionals to determine whether it's an appropriate therapy for the person, whether it would be harmful in any way to the person, and that there is solid evidence that it is not experimental treatment. Another question asked of the MHCP would be other cost-effective methods that may have been tried but are unsuccessful. On a side note, CDCS funds may be used for additional or extended therapies that are funded through MA. MA usually has a limit of sessions, and waiver funds can be used to extend the sessions if needed by the person. Funds to help offset the high cost of specialized alternative diets, such as gluten-free diets, may also be considered in this category. To utilize these funds, the managing party must have an MHCP physician complete an alternative therapy form indicating the person qualifies for one of the listed approved diets. Please see our guidelines for more details. It is important to note that some participants may be on multiple diets, and some of these may overlap. If they do, only reimbursement is approved for the cost of the more expensive diet, not both. Please talk to your support planner for calculations. CDCS funds can be used to pay for the consumer or caregiver trainings or conference fees in person or online, and any training materials. The CDCS plan must state the title and the description of the training and how it relates to the person's disability, and then approved by the lead agency. Adaptive camp fees are allowable on CDCS as well. Camps are funded similarly to community classes and activities. Camps such as Camp Friendship that have all specialized trained staff and accommodations are fully fundable. Typical camps may be considered if there is an extra cost associated with supporting the participant, or if the participant's CDCS staff needs to attend with the person. But typically non-adapted camps are considered a parental responsibility. Lastly, licensed waivered services or traditional services can be used on CDCS. Licensed waiver services are not commonly used on CDCS because the licensed agency does not have as much flexibility as the participant using unlicensed service does. These services can be quite a bit more expensive than unlicensed services too. One of the benefits of using licensed services is that there is an agency to assist with some managing party tasks. These include recruitment, hiring, and training for the staff person. A downside is that things like the training requirements, the choice of staff being hired, wages, and rates are determined by the 245D licensing statute through the agency and potentially the statewide rate setting system. This generally means that licensed waivered staff services cost the CDCS budget more money than hiring staff directly through the FMS to complete the same specific tasks. Often staff are paid a lower wage through the licensed agency. Common examples of licensed waivered services may be day support services, employment supports, homemaking services, or respite. Respite is the licensed version of primary caregiver relief. It can occur in the home, in the community, and during the day or overnight. Next, let's look at environmental modifications and provisions. The modification and provisions category is kind of a catch-all category for services and goods not addressed in other areas. The main purpose is to support the participant in accessing their home and community and maintaining their health. This may include adapted items or assistive technology that are one-time purchases. It could be transportation costs or environmental accessibility adaptations. Adapted items may include a one-person trampoline, fidgets, or noise-canceling headphones to address sensory needs. These items may be considered adapted to meet the person's assessed need. The item itself may have modifications to make it adapted, or it may come with a feature for the specific person that is adapted. These items still must be the most cost-effective way to meet the person's assessed need. Assistive technology falls into this category too. One example of assistive technology is a tablet or computer that assists with communication, emotional regulation, and/or accessing the person's environment. Computers and tablets cannot be purchased for the sole purpose of communication, since devices for communication only can be purchased with medical assistance. The purchase of a computer or tablet can be done every 3 years and up to $1,000. CDCS can only purchase what is needed to meet the assessed needs. In order to approve a computer or tablet, a recommendation must be received by the appropriate professional, such as a speech therapist, occupational therapist, mental health professional, behavior specialist, or an assistive technology professional. The lead agency will need a professional to assess the device for the individual, define how it will be used, how the device will be kept safe, and how the person will be trained. Other examples of assistive technology include GPS tracking devices, alarms or cameras, computer applications, or software. Transportation costs can also be funded for individuals who have an assessed need that limits their ability to drive themselves. Transportation options must be cost-effective and reasonable solutions to accessing the community. There are different forms of transportation. Transportation such as city buses or Metro Mobility are one of the cheaper ways to go. However, these public options have limitations and other options such as using Uber and Lyft or taxis may be needed, or some sort of combination. Some participants may not be able to use public transportation independently. In this case, staff may be used to transport the person to appointments and be reimbursed for mileage. The mileage rate in the plan cannot exceed the current federal reimbursement rate, which changes on an annual basis. Paid parents of minors are not allowed to get reimbursed for mileage. In environmental modifications and provisions, there may be bigger expenses, like home modifications or van modifications. Because we do not want these needed expenses to eat up the majority of someone's budget, DHS and the counties have set aside additional funds that can be tapped into to help cover these larger expenses. You are allowed up to $40,000 per year to do home and/or vehicle modifications combined. You will have to set aside the first $5,000 in your CDCS budget, and the remaining funds will need to be approved by the lead agency. ACEW participants are allowed up to $20,000 for home or vehicle modifications and must fit within their budget as there are not outside funds to be able to pull from. If you would like to pursue home or vehicle modifications, you and your case manager must follow our environmental accessibility adaptation process. In Carver County, we use the service of home modification assessors. These assessors will assess the health and safety need of the person, obtain 2 bids, and then help manage the project from start to finish. We want these projects to go smoothly. Therefore, we use these experts throughout the process. Assessors are part of the $40,000 per plan year. There is a process to borrow into the next year if the project exceeds $40,000. But there is a high threshold for DHS to approve this. Your case manager will guide you through this entire process. It is important to know that we are not able to simply replace broken or damaged items in a home, but we can make modifications or adaptations to the environment to mitigate the problem. An example, Mark typically targets doors and windows when he's upset, and they can easily become a safety hazard. We would not fund the replacement of broken doors because they are broken, but we would potentially remove them and replace them with solid core doors that do not break when Mark hits or kicks them the next time he is upset. We would not replace an entire window, but could look at putting plexiglass or film over the windows so the next time Mark is upset, he doesn't break the window. When there are significant destructive behaviors in the home, we sometimes require the assistance and consultation of a behavioral professional to help decide on the best course of action to help fix the problem. Talk with your case manager about specifics on environmental accessibility adaptation projects and the process. Now let's talk about self-support activities. The self-direction category typically consists of fees to help administer CDCS. It includes FMS fees, staff fees, support planner fees, and recruitment fees. These costs tend to be the set costs and are the services that help the CDCS plan run smoothly. Support planners may provide a variety of services to the participant and managing party. It's important that you discuss with the support planner what tasks you would like them to provide. We cannot duplicate services, so it's important to be clear the role of the support planner and case manager. It is a good idea to start with the case manager since their costs do not come out of the CDCS budget. Support planners typically charge between $50 and $60 an hour. You, as the participant or managing party, must decide the best use of the funds. Please see our suggested considerations for the number of support planner hours to complete initial plans versus renewal plans in our guidelines. Recruitment services can be used to advertise in a newspaper, online, or through a recruitment agency. It is important that the recruitment agency only provides recruitment services. The staffed person must then be hired by the FMS even if the recruitment agency provides staffing services. Any unlicensed staff not certified or licensed to provide a specialty service typically must be hired by the FMS to provide services to the participant. FMS support planner and recruitment fees sometimes vary month to month or year to year. It is best to use the fee amounts that you and your support planner know to be the most current, but be prepared that the fees may change, in which case the plan may need to be updated even after your case manager or lead agency has approved the plan. We do not typically approve program supplies like printers, file folders, and stamps because most of the managing party duties can be done online. However, we would consider some of these costs depending on the situation. Next, we look at home care services. MA, or Medical Assistance Home Care, is the final category. This category is not used as often as the others. The services that fall into this category are home health aide, personal care assistant, home care nursing, or skilled nursing visits. These services must be provided by a 245D licensed provider and must be documented in the CSP as such. Most private health insurance and medical assistance do not cover nursing services, so these services must be included as an expense in the CDCS budget. These home care services do not bill a financial management service agency like the other services on CDCS CSP do. They bill the state system directly and must still fit within the participant's CDCS budget. Because it does not go through the FMS, it is not tracked, so it can be difficult to track these expenses. So it is not usually a good idea to stray from the number of unit or hours determined and approved originally as part of the plan. If you overspend these hours and do not have the funds in the CDCS CSP to cover the overage, you will be responsible to private pay that amount back. You can ask your case manager to check on the usage, but the information is only as good as the billing is up to date. Occasionally we run into the situation where a parent of minor also happens to be a nurse. Parent of a minor cannot be paid to provide nursing services on CDCS. Parent of minor can only be paid to provide personal assistance activities. However, parents that are not their legal guardian can provide nursing services if they are hired through a licensed home care agency. Nursing tasks like wound care or medication administration must be provided by a staff that is licensed to do so. CDCS support staff are unlicensed and cannot be paid to complete these tasks. If the participant has these assessed needs and they are not being met informally by themselves or family, then a licensed staff, like a nurse, PCA, or home health aide, must be hired to do so. Parents as a support staff may receive additional training for medical conditions, and this is recommended. However, they are still not able to complete tasks that require a license. Nurses hired through a nursing agency or as an independent contractor may receive incentive bonuses just like other CDCS staff are eligible for. Finally, please be patient with yourself and the support team. As you can see, there's a lot to know about CDCS and it continuously changes. If you have any further questions, please contact your case manager. This concludes our expense category training. Thank you.